Our disease is typhoid fever, also known as typhoid. Other names associated with this disease are gastric fever, enteric fever, abdominal typhus, infantile remittent fever, slow fever, nervous fever, and pathogenic fever. Many of these names are more descriptive of the disease, as you'll see under our signs and symptoms. Etiology. The bacteria that causes typhoid fever is called Salmonella typhi. It is a gram-negative bacteria. Its morphology is bacillus or rod-shaped. It is motile biflagellum, and it is non-spore forming but does have endotoxins as well as the VI antigen, which increases its virulence. Pathology. The typhoid bacteria gets into the bloodstream as well as adheres to the wall of the intestinal tract. S. typhi usually invades the surface of the intestine in humans, but have developed and adapted to grow into the deeper tissues of the spleen, liver, and the bone marrow. Transmission. Typhoid fever is transmitted person to person, or by consumption of fecal contaminated food or water by someone with typhoid, particularly undercooked meats. Proper cooking does kill the bacteria. Though it is not common to contract typhoid in the industrial countries such as the US, there are about 400 cases a year in the United States, most being contracted while traveling to developing countries, where typhoid is still common. Epidemiology. Typhoid has been known to kill 600,000 people a year globally. In the US, it hit a steep decline in the early 20th century due to new sanitation regulations. As you can see in our graph here, the death rate for typhoid fever in the United States from 1900 to 1960, there's a steep drop off just before 1910. This is when chlorination began with the water filtration and treatment. The decline continued until about 1950 when death from typhoid was no longer prevalent in the US. Epidemiology worldwide. In 2000, typhoid fever caused an estimated 21.7 million illnesses and 217,000 deaths. In 2013, it resulted in about 161,000 deaths. Outbreaks of typhoid fever are frequently reported from sub-Saharan Africa and countries in Southeast Asia. Developing countries where sanitation is lacking are most susceptible to typhoid. This map shows incidence of typhoid fever globally. The red countries are where it is strongly endemic, orange is endemic, and the gray countries are where there's just sporadic cases, as in the US. Mortality rates. Historically, in the pre-antibiotic era, the case fatality rate of typhoid fever was 10 to 20%. Today, with prompt treatment, it is less than 1%.
Humans are the only reservoir of Salmonella typhi infection, as well as the only natural host. So, in other words, humans are the only causative agent of the disease and act as its source of further infection. Among humans, there are several types of carriers. Salmonella typhi is known to mainly colonize the gallbladder, and it remains there long after symptoms subside. The most common sites of infection are the ileum, the liver, the spleen, bone marrow, and the gallbladder. There's also a strong correlation between the chronic carrier state and the presence of gallstones. The carrier itself may be temporary, incubatory, chronic, or convalescent. Convalescent carriers shed typhoid bacilli for more than 3 months after the obtaining acute sickness. However, relapses may occur. As far as chronic carriers go, about 2 to 5% of those that have contracted typhoid fever will be chronic carriers. A chronic carrier is one who sheds typhoid bacilli for more than 12 months after the obtaining of the acute sickness and has no history of typhoid or had the disease over 1 year previously, yet has 2 feces or urine culture samples positive for Salmonella typhi separated by 48 hours. Other carriers can be known to to have typhoid bacilli isolated from tissues or organs via surgery or from draining lesions. And the signs and symptoms during the first week of typhoid fever is a sustained and systemic fever. It starts slow and increases daily. So this means that in the beginning of the day, one might have a very mild fever, and throughout the day, it increases to get more intense. And this happens day after day, often as high as 103 or 104 degrees Fahrenheit. Also coupled with this can be severe headaches, weakness and fatigue, dry cough, loss of appetite, abdominal pain, diarrhea or constipation, or rash. The signs and symptoms during second week include, but aren't limited to, continuing high fever, severe constipation or diarrhea, considerable weight loss, and an extremely extended abdomen. During the third week of typhoid fever, one might see themselves becoming delirious, lying motionless and exhausted with eyes half closed. This motionless and exhausted state is known as a typhoid state. During the fourth week of typhoid, improvement may come slowly. At this point, if one has survived, they will be continuing to get better. Fever will likely decrease over the course of 1 to 2 weeks, and signs and symptoms could return up to 2 weeks after. Please keep note that while signs are what a doctor sees, symptoms are what a patient experiences. A symptom can be described as one of the characteristics of a disease, whereas a sign is the definite indication of a certain type of disease. Other symptoms include hepatosplenomegaly. Now this is the simultaneous enlargement of both the spleen and the liver. Also, other symptoms may include a transient macular rash of rose-colored spots. This is usually found on the trunk. And after 2 to 3 weeks of illness, one may notice intestinal hemorrhages or perforation, both of which can be life-threatening. Now, typhoid fever among children, their signs and symptoms tend to be pretty similar. Sometimes they become sick, and yet signs and symptoms take 1 to 3 weeks to appear after exposure. So when should one see a doctor? Immediately. I mean, if you have typhoid, go immediately. Come on, look at that guy. Yeah, he seems pretty nice. Why wait? What do you got? What other pressing matters do you have? Just do it. But, if you are traveling and you don't have a doctor, one will be provided for you. I'm sure the place that you're visiting doesn't want typhoid to spread rampant. You have the right to remain healthy. If you don't remain healthy, then you will be sent to be quarantined like Typhoid Mary. Okay, probably not, but look how angry she is. Treatment. Initially assessed by blood culture or bone marrow culture, as well as sensitivities to antibiotics. So we have antimicrobial therapy, which shortens the clinical course of typhoid fever, good thing, and reduces the risk of death, also good. There's empirical treatment. The empirical treatment mostly is used fluoroquinolones. However, cephalosporins are used when fluoroquinolones non-susceptibility is high. This is present in Asia and India. Azithromycin is increasingly being used due to the emergence of multi-drug resistant strains. Management. Patients treated with an antibiotic might still require 3 to 5 days for the fever to subside completely. However, if the fever fails to subside, alternative antimicrobial agents should be considered. Unstable patients should be hospitalized and given IV treatment. And those that are caring for the patient that is hospitalized should also be meticulous about hand washing and of the disposing of the urine and feces of the patient, so as to not contract typhoid fever as well. Prevention. The most important type of treatment is prevention. The most important protocol to prevent typhoid is to follow recommended food and water protocol. If in a location where typhoid is a danger, one should eat cooked food and bottled water only. One should avoid salads, uncooked vegetables, as well as unpasteurized dairy products. See, look how, see, he doesn't want to eat that. It's uncooked vegetable. One should also wash hands frequently. One should be aware of the diseases that are prominent in the areas that they travel. A typhoid vaccine is recommended by the CDC for travelers where there is an increased risk exposure to Salmonella typhi. Vaccines available in the U.S. include one oral live attenuated vaccine, Vivotif, or bicapsular polysaccharide vaccine. However, the vaccines protect only about 50 to 80% of recipients. So, if one gets a vaccine, they should still follow safe food and water procedures when in areas that may have typhoid fever. And that is our resources.
Did you know? Typhoid fever is often confused with typhus, a louse-borne disease, because they share common symptoms of fever, rash, and headache. The word typhoid actually means resembling typhus, and comes from the neuropsychiatric symptoms of delirium, common to both diseases. Until about 1837, the words typhus and typhoid were often used interchangeably for both diseases, even though typhoid has likely been a recognized disease since the time of Hippocrates in ancient Greece. Traveling tips. If you are traveling to developing countries where typhoid fever is still common, these food safety tips will help you stay healthy and away from typhoid fever. Adopt boil it, cook it, peel it, or forget it. If you drink water, buy it bottled or bring it to a rolling boil for 1 minute before you drink it. Bottled carbonated water is safer than uncarbonated water. Avoid raw vegetables and fruits that cannot be peeled. Vegetables like lettuce are easily contaminated and are very hard to wash well. Avoid foods and beverages from street vendors. It is difficult for food to be kept clean on the street, and many travelers get sick from food bought from street vendors. Additional information. Salmonella typhi is only found in humans. Salmonella's ability to change its phenotype and genotype in response to environmental changes make it almost impossible to eradicate from the food chain. In relation to the restored gospel, the prophet Joseph Smith contracted typhoid fever when he was 7. The infection reached the bone in his leg, and he underwent a relatively experimental surgery as a result, drilling out the infected bone. He walked with a slight limp the rest of his life. Speaking of typhoid fever, Nathan Smith, Joseph's doctor, noted, "I have not perceived that occupation or habits of life make any difference in their ability to receive this disease, nor has it in this country been confined to the poor and filthy, but affects nearly alike the rich, the poor, and the middle class." Typhoid Mary. As Gary noted, another famous case of typhoid fever occurred in the early 20th century. Mary Malone, or more commonly known today as Typhoid Mary, was a cook in New York and, unknown to her, a healthy carrier of typhoid. She infected 50 people, 5 dying from it. She then infected another 25 at a women's hospital in Rhode Island after it was discovered that she was a carrier. Carriers. Like Mary, a small number of people who recover from typhoid become carriers, where they have no symptoms but can still affect other people, as Gary explained to us the different types. Mary Malone was the first traced carrier in the United States. This is a picture of Lizzie Van Zyl, who was a child inmate in British-run concentration camp in South Africa, who died from typhoid fever during the Boer War. Historical epidemics. Researchers speculate that typhoid killed more than 6,000 Jamestown settlers between 1607 and 1624. In the war against South Africa in the late 19th century, British troops lost 13,000 men to typhoid, but only 8,000 in battle. Resources.